At the outset,
Recording in
I'm
progress.
wishing all of you a very happy 2022. I wish and hope all the HCPs and the near and dear ones are taking adequate measures and following COVID appropriate behaviors as we are battling the new variant and keeping that variant at bay. We thought that at current times when the virus is on roll, it is creating havoc. It's a right time, it's prudent to discuss something like this, something, the topic like this, the role of micronutrients and probiotic in RTIs. And we were lucky enough when we approached to our panel, they agreed to speak on this topic. So we are thankful to them. We are lucky enough to get Dr. Vora on board from Assam, Dr. Ghazi Sharik Ahmed from Katihar, and uh, moderator for this evening, Dr. Shomik. It is always a pleasure to have you on board, Dr. Shomik. So, as we go forward, let me take the pleasure in introducing Dr. Shomik. Though Dr. Shomik is a name who needs no introduction, he's an Mauritius speaker from East Zone, and it's a goosebumps raising experience listening to him. Dr. Shomik is MD Gold Medalist, MRCPCH, UK, pediatrician from Kolkata, author of number of publication in peer-reviewed journals, including BMJ, speaker in different national and international conferences. So with that, I would like to hand over the session to Dr. Shomik. Dr. Shomik, over to you.
Thank you, Paulash, for giving me the opportunity to moderate the session and giving me the opportunity to share the screen with such eminent dignitaries from East Zone, including Dr. Partha Vora and Dr. Ghazi. Well, the situation outside is pretty bad. So the best thing that an academician can do is to come back to his or her house and delve into some good level of academics so that he can or she can enrich herself or himself and be of benefit to the society in a slightly more efficient way, maybe. So right now, yes, we are dealing with deadliest or the most significant waves of this COVID-19, though it might not be the deadliest one. I have got friends and relatives affected. I'm sure this is the same case with everybody. But what we see is that there is a change of behavior of the virus. Currently, it is having extensive amount of infection, but less amount of severity. That brings us to the point to think upon that, yes, there could be so many respiratory tract illnesses and so many causative viruses and bacteria, and they can actually behave in a way that might not be expected. And so can we, as such, think of a solution, or not only a solution, think of a supplement or think of something that can enable our bodies or bodies of our kids to fight off any respiratory tract infections, because there are countless number of viruses and we cannot simply go on adding molnupiravir or some other or favipiravir or something or the other or coamoxiclav like a definitive drugs to stop the progression. It is always better to kind of enabling ourselves to fight off such illnesses. So on that note, I take the privilege to introduce Dr. Partha Vora, who would be our first speaker today. He's a consultant pediatrician and neonatologist from Guwahati, Assam. He is attached to the Pratiksha Hospital. He has been trained in pediatric bronchoscopy from National University in Singapore. Incidentally, I had a short stint in National University Singapore in pediatric gastroenterology. He was first to initiate pediatric flexible bronchoscopy in the entire Northeast Indian region, covering all the 8 states. So that is a achievement. That is an achievement quite noteworthy and praiseworthy. So I hand over the mic to Dr. Partha Vora, who would be talking upon the role of micronutrients as such in respiratory tract illnesses. Over to you, Dr. Vora.
Good evening, Dr. Samik, and good evening, everyone. Dr. Gaji and the team from Lupin. Thanks, Samik, for the nice words. And of course, we could understand the scenario that we are going through. Last 2 years have been it's just a roller coaster ride. Sometimes we are good, sometimes we are again the same. I think we're back in the same track where again we'll be bound to our homes, bound to our restricting our mobilities actually. Anyway, life goes on and we'll have to also move on along and according to the scenario. So as aptly described, as last 2 years have been the best period when we have come to know and we have discussed and we have thought about, and in fact the parents whom we met, they have also come have given the importance of nutrition, and nutrition has been immensely discussed, and people have right now has immensely thought that what the role of nutrition is in these, and the common word that people and the parents commonly ask about us is that, sir, give us something which will boost the immunity of our child. Any medicine, any vitamins. We don't want our near ones and dear ones to suffer from this pandemic. So rightly we are discussing about the at the right time. So we'll be discussing about the nutrition, the importance of micronutrients, and their importance in the respiratory tract infections, especially in our population, the pediatric age groups. So I'll be sharing my slides now. I hope my slides are visible.
Yeah, they're clear and visible.
Yeah, thank you. So we will be discussing about the impact of micronutrients on the respiratory tract infection, especially in the pediatric age group. See, most of our pediatricians, what I call is the bread and butter for a pediatrician is, although vaccination is a second thing, but we commonly encounter with CCF. It's not the congestive cardiac failure, but the cough, cold, and fever. This is one of the common symptoms with which the most of our patients comes to our OPD, and it is well known that the children, especially the preschool children, are especially prone to these recurrent respiratory tract infections or viral infections, or sometimes they are affected by the bacterial infections also. And this, and then they have there's a high incidence of this disease, especially in this age group, and which results in actually in substantial morbidity. And there is, of course, due to the recurrent infection of the nutrition and then malnutrition and nutrition sequelae, and they have a lot of potential long-term morbidity also. Of course, from our side, there is always tendency of overdiagnosis, and especially most often we tend to diagnose bacterial infections, especially Streptococcus pharyngitis or otitis media in these age groups. And we need to know about the rationality behind treatments, and we often see the associated overuse and misuse of antibiotics associated with this recurrent respiratory infection, which result in a lot of healthcare costs, and as well as there's indirect societal cost also. So what is the pathogenesis actually? We know there is a high incidence of RTIs, especially in young infants and preschool children, and resulting because of the increased exposure to respiratory pathogens by siblings and in the child cares, and especially when the children are going to school. Last 2 years, of course, there's a dramatic fall down of this respiratory infection because the children were not going to school and to the daycare centers. So, but as soon as the school opened up, if you could remember, in the month of June, July, and August, there was this big surge of viral infection which occurred. We could see all kinds of viral infection, right from influenza up to respiratory syncytial virus, and almost all cities and towns in all over India, they were flooded with viral respiratory infections, and most of the intensive care units were full with patients. And all the children were comparatively well during this in the last 2 years. They came back with symptoms of respiratory symptoms. Of course, there are environmental factors which results in the recurrent respiratory infections, and sometimes children who are malnourished, or children who have malnutrition, or children who have defects in their immune system can also have recurrent respiratory infections. So the high incidence of respiratory infection in young infants and preschool is explained by the crowded conditions, especially in the daycare settings, and there could be favor of colonization and spread of pathogens. We know about the exposure to passive smoking, indoor pollutants, and of course, the most important thing, the lack of exclusive breastfeeding, especially in the first 6 months of life. And of course, there could be familial predisposition of recurrent and severe respiratory infections, and there could be some genetic predisposition associated with some anatomical, physiological, or immunological features, which could be seen in certain population of the children. So what are the consequences? Because of this frequent respiratory infection, we can have frequent medical visits, and is resulting in school as well as in parents' work absenteeism. There could be overuse and misuse of antibiotics, resulting in bacterial resistance, and which can result in negative impact on the quality of life. And because of recurrent infection, there could be decline in lung function as well as increasing in the economic burden of the society. So how do you manage these respiratory tract infections? The development and spread of antibacterial resistance in bacteria that commonly causes community-acquired RTI is a major global healthcare problem. And of course, unnecessary or overuse or misuse of this antibiotic therapy has resulted in the development of these superbugs or the bacterial resistance, which could have actually been avoidable, and they're resulting in the increased cost. And hence, improving antibacterial use in children are an important for the physiological physicians in charge. So the nutritional status is directly related to the inflammation and as well as consequently to the immune response. And micronutrient supplements like vitamin D and C and treatment with vitamin D, C, and zinc in acute respiratory infection has been well documented nowadays. And there's a multiple micronutrient supplement in older people may also reduce antibiotic uses. So just an overview of the immune system, we well know about it because from our MBBS days, we've got the innate immune system, which is the physical barriers, the defense mechanisms, and we have the general immune responses, where the leukocytes, phagocytes, and the complement system acts. And then we have the adaptive or the acquired immune system, where we have the B cell and the T cells, and the resulting formation of the CD4, the CD8 cells, which are responsible for recognitions and activations of both the MSSI and MSSI2s. So what are the different macronutrients and what is the role in our development of the immunity? Well documented is the vitamin C, and I think one of the drug that has been I think it's been misused or overly used in last 2 years is the LIMC drug, with the vitamin C tablets. And we all know that vitamin C is absorbable, and it's water-soluble vitamin, and it is an essential macronutrient. Of course, we know about the sources, most commonly the citrus fruits and the green leafy vegetables. And of course, the provisions of dietary vitamins is depend on the food preparations and easily destroyed by prolonged storage and overcooking. And there are a lot of meta-analysis, especially by Hamilia and Lohela, analyze the effect of vitamin C in preventing and treating pneumonia, regardless of the etiology. So vitamin C has got a role in the immune defense system. It protects our epithelial barriers, improves the antioxidant and the microbial killing of the phagocytic and the neutrophilic macrophages. It also improves the B and T lymphocytes, enhances differentiation and proliferations, and enhances antibody levels. And also it helps in the inflammatory mediators and modulates the cytokine productions. We of course know about vitamin D nowadays, and vitamin D is well supplemented right from birth, and especially in the infants. And it's a fat-soluble vitamin, and it's mainly synthesized by skin after exposure to ultraviolet rays from sunlight. And to lesser extent is also that there are certain dietary sources in the form of vitamin D or tree, where we could get it from the fatty fishes, fish oils, egg yolk, and sometimes from cheese and vitamin D fortified food. Vitamin D also has a major role in the immune system, a significant role in controlling the innate as well as the adaptive immunity, and also suppresses the proliferation and differentiation of the B cells by inducing apoptosis and inactivated B cells. The important peptide form, which is the cathelicidin, is a small. It's a peptide formed by vitamin D, which stimulated expression has shown antimicrobial activity against bacteria, fungi, and envelope viruses such as coronavirus. Furthermore, vitamin D inhibits the production of pro-inflammatory cytokines and increases the production of anti-inflammatory cytokines. Zinc also has got a major role, and it's one of the which has been used rampantly during the acute gastrointestinal infections, and we know about the role in the respiratory tract infections as well. It regulates the functioning of both the adaptive and immunity, and of course, the dietary sources includes meat, fish, and eggs. And animal sources, of course, has got a higher viability compared to zinc derived from the plant sources. Zinc has got it helps in the normal development and functioning of the cell-mediated immunity, as well as neutrophils and natural killer cells. It's a major constituent of actually most of the enzyme systems in our body, and as well as it also affects the macrophages, and phagocytes and intercellular killing and cytokine production are also affected by zinc deficiency. There are a lot of studies which have, especially this study from Colombian children, But the effect of zinc supplementation in the prevention of respiratory tract infection and diarrheal disease was done. It is a 12-month randomized controlled trial, and it is well shown that children were supplemented by zinc during the 12 months significantly decreased the incidence of upper respiratory tract infections in a healthy population of children. So there is both prophylactic and therapeutic effectiveness of zinc supplement in common cold, and there is significant decrease in the symptoms associated with common cold as well as the common cold related school absentees in children who have been supplemented with zinc. The use of zinc both as prophylactic and therapeutic in symptoms like duration of cough, the nasal drainage, nasal congestion, headache, all these symptoms also has got a significant shorter duration in children who have been supplemented with zinc. Zinc also has been seen when you compare the placebo. It has been seen that the children who have been supplemented with zinc, there was a decrease in the absence of 0.9 day in children who have been supplemented with zinc as compared to the placebo group. A lot of meta-analysis, and there is the data on the frequency of respiratory illness was available in 12 studies, and it included around 2,000 children who received zinc supplements and around 2,800 children who received the matched placebo. And pooled data showed an 8% reduction in occurrence of those respiratory illness among children who received zinc supplements. Now, the role of zinc administration in prevention of childhood diarrhea and respiratory illness. There's a meta-analysis from Rakesh Agarwal et al., and it showed that the zinc supplementation in healthy children led to significant but modest reduction in the frequency of diarrhea and respiratory illnesses, and the intervention also led to reduction in frequency of severe diarrhea and lower respiratory infections. There are also trials which have shown that in children in developing countries were identified in systemic literature review, and there are 10 trials, including around 49,000 children, and routine zinc supplementation reduced the incidence of both acute lower respiratory infections to a significant level. Vitamin D has also been widely studied, especially during, and its association has been studied in the corona in the pandemic also. And the systemic and review and meta-analysis have shown that the events of respiratory tract infection in vitamin D group and placebo group, and there's significant reduction both in the vitamin D supplemented group, and there's prevention of respiratory infections, especially in the pediatric populations. This study which has come from Mongolia, and showed that compared to children in the control group, children receiving vitamin D fortified milk was less likely to report one or more ARIs over the winter. The frequency has an inverse association between vitamin D and supplementation and risk of ARI. And in fact, Mongolia has been considered as one of the first country to be corona-free because of their, in fact, the nutrition and the environmental sanitization and the policies that they followed. And it is the first country which has been considered now as the corona-free country. So probiotics and vitamin C for prevention of respiratory tract infection in children attending preschool is a randomized controlled trial. Within children between 3 to 6 years of age were enrolled, and the incidence rate of upper respiratory tract infection on 33%. The number of days with upper respiratory tract infection between 21 days observed, and the number of days of antibiotics and painkillers supplements and nasal condition was also studied. So supplementation with probiotic and vitamin C combination may be beneficial in prevention and management of upper respiratory infections. So in my concluding remarks, the medical and societal burden of RTI in children is enormous. And the special problems are recurrent RTIs are due to increased exposure to respiratory pathogens, environmental pollution and defects in the immune system. A well-functioning immune system is important to help reduce the risk of infections. And currently published data currently published data confirms the well-established role of micronutrients in supporting the immune system. Vitamin C and other micronutrients are understood to work together to support an immune system based on a variety of mechanistic and clinical data. So supplementation with vitamin and zinc appears to be safe and low-cost way to support optimal functioning of the immune system and reduce the risk and consequences of infection, including viral respiratory infections. And supplementation should be in addition to a healthy diet and fall within recommended upper safety limits set by scientific expert bodies. Thank you.
Well, this was a wonderful and insightful presentation on the role of different micronutrients in respiratory tract infections of different etiologies. Now, there are two things that kind of stands out. One is obviously vitamin D. We have studied quite a lot in the past few years about vitamin D, and the other one is zinc. Now, the role of zinc is a bit controversial in upper respiratory tract infections. There are also data of suggesting that there is no significant benefit of supplementing zinc. But on the other hand, we have been using, and all the guidelines are recommending zinc usage for 15 days in acute upper respiratory tract infections associated with COVID-19. So definitely zinc has got its case. But more fascinating is the role of vitamin D. That what I believe, especially its immunomodulatory effect on vitamin D. So this immunomodulatory effect of vitamin D is the new kid in the block. It has now been extensively studied for the past few years or so, and it is kind of opening up so many new avenues in terms of modulating the immune response to a certain subset of disease or in a certain subset of population. And considering that we at the tropical country are endemically vitamin D deficient, I do believe that vitamin D supplementation, especially in kids who are having frequent respiratory tract infections or who are asthmatic or who are having some respiratory problems or the other, definitely holds merit. So thank you, Dr. Vora. We will come back to discussions once both the direct talks are over. So please be with us. I now invite Dr. Ghazi S. Ahmed. Dr. Ghazi, can you just, yeah. So our next speaker would be Dr. Ghazi S. Ahmed. Again, Dr. Ghazi S. Ahmed is someone who does not require an introduction. He is one of the pioneering pediatricians from Eastern Zone, yet again, and he is the current professor and head of Katihar Medical College, Department of Pediatrics. He has done his MBBS from Katihar Medical College itself. So he's a homegrown now champ from the institute, and he has also done his MD in pediatrics and adolescent medicine. He has got 13 years of experience as an academician and a clinician, and he's running a 25-bedded NICU at the Bacha Hospital in Katihar, which has got level 2 and level 3 facilities, which is again something that is praiseworthy. He has got 15 publications till date. I am sure that it will multiply leaps and bounds in the coming ages as well. And he has received multiple gold medals and different awards from his institute as well as from international bodies. So without much delay, I take the opportunity to hand over the mic to Dr. Ghazi S. Ahmed. He will be talking upon the other new kid in the blocks in terms of the respiratory pathologies and in terms of the immunomodulatory effects, and that is the supplementation of probiotics. So over to you, Dr. Ghazi.
Thank you very much. And without wasting time, I will start my presentation first. Let me share my slides. So once again, thank you, Dr. Shamek, for the introduction, which was so much explained. And now we will discuss the probiotic for lung health. As we have discussed so much things right now and about
Sorry
the
to
lungs.
just interrupt you, Dr. Ghazi. Can you just go to the full screen menu?
Yeah, it's already on full screen.
No, we at our end we are having the screen, but it's not the full screen. Can you just do that? Thank you.
Is it?
Just switch on to the slideshow sections.
Still not on full screen. Is it okay now? Hello?
No, sir, it is not okay.
Not okay.
Before starting your presentation, you have already in full screen, sir. That mode you have to in full.
Okay. Just a minute. Is it full screen now? It's not a shared screen, but okay. Okay. Not yet. Okay. Stop. Yeah, share screen. The screen option. Well, where is this screen option? Yeah, first one. Okay. It's okay now?
Very perfect, sir.
Okay. Thank you. So we are talking about the probiotics and the lung health. So going to the background, this probiotics has got a very long history. Ancient civilizations such as Greek and Romans developed recipes for fermented milk, and Bible also has some mentions about this sour milk, which indicates the Lactobacillus and its uses and its importance. The beneficial effects of lactic acid fermentation on human health have been long discussed. Non-pathogenic bacteria that promotes beneficial health effect when ingested have been termed probiotics. We all know that. There are several microbes. Some of the microbes are beneficial for health, particularly in a certain doses, through a certain routes or at certain places in the body. They are predominantly Lactobacillus, Bifidobacterium species, followed by some strains of the Streptococcus, Enterococcus, Bacillus, and Escherichia coli as well. Furthermore, although the Food and Agriculture Organization FAO and WHO currently define probiotic as live organisms that, when administered in appropriate dose, confer a benefit of health on receiver, non-viable microbes have also been regarded as probiotic because in certain circumstances they exhibit beneficial effect equal to the live bacteria. We can see that there are several things, several part of the body, several functions of the body, several systems of the body has got some beneficial effect from these probiotics, including the gastrointestinal tract. We have got the multiple evidences, multiple recommendations regarding the use of probiotics in gastrointestinal symptoms like gastroenteritis, antibiotic-associated diarrheas, traveler's diarrheas, lactose intolerance, etc. In allergies, in respiratory diseases like asthma, cystic fibrosis, neurological cases, even in some autoimmune diseases, oral diseases, some cancers, and of course, there are several recommendations in intestinal colic as well. But we are talking about the respiratory disease and the role of the probiotics in this. So we will concern with that and we will discuss that today. So impact of probiotic on respiratory system and the immune system as a whole, because the immunity plays a very important role, and almost everybody, even a layman, is now acquainted about the role of immunity and the lung disease after this corona episode. Significant attention has been focused on the role of probiotic in gastrointestinal development, immune adaptation, and attenuation of GI inflammatory diseases. There is steadily increasing evidence that orally delivered probiotics are able to regulate immune response outside the GI tract as well, including the respiratory mucosa. So this is very important in maintaining the health of the mucosal lining. So this slide is enough or self-explanatory that there are competitive exclusion of the pathogenic microorganism happens when there are the two beneficial microorganisms and the pathogens, the real disease-producing organisms are there. There is a race. Production of the antimicrobial substances is being done by these organisms. Increased adhesion to the intestinal mucosa, improvement of the epithelial barriers, and stimulation of the immune system. This all happens in this. The physiology and pathology of the respiratory and the gastrointestinal tract are closely related, as we all know that the similarity between the two organs may underlie why dysfunction is one organ may induce illness in the others. And the upper respiratory tract, oropharynx, both these systems are closely opening at the same places. So they are related, both are having mucosal linings, both are requiring the healthy mucosal lining, healthy mucosal immunity. So the fact that probiotic can be used for the modulation of all these parts, particularly the mucosal lining, and hence the lung will get benefited. In particular, the encouraging indications that microbial stimulation of the gut can enhance the T regulatory response in the airways, emphasize therapeutical potential as well as the need of the greater understanding of the mechanism underlying effects of these specific strains. There is a term known as gut-lung axis for the probiotic action. And as this, we can see that the small intestine produces so many things, particularly the immune modulators and the cytokines and cytokine-related responses, which also acts upon the lungs because of the mucosal lining in particular, that also helps in reaction or getting protected from the microorganism. There is accumulative evidence that bidirectional communication exists between gut and lung, which is called gut-lung axis. It is believed that gastrointestinal inflammation results in lung inflammation through this connection. The exact mechanism underlying this inflammatory shift from the gut to the lung is not yet completely revealed. There are so many studies going on, and the new publication will come, and we will get more clear data upon this. Dysbiosis of the gut and lung microbiota is one of the most implicated factor in the event, and it has been shown previously that dysbiosis of gut microbiota is linked with several respiratory pathological conditions that shift in composition of the lung microbiota towards the gut microbiota have been observed in several respiratory disorders. The bidirectional, the gut and the lung term as lung-gut axis is best exemplified by intestinal disturbances observed in the lung disease. Some of the existing probiotics shows beneficial effect on the lung health. The metabolic or metabolites like small chain fatty acids produced by gut bacteria move through the bloodstream to stimulate immune response in the lung, and that particularly the lymph nodes and the lymphatic channels play the important role in this, and the lung gets affected and the gut by the gut immunity response. Probiotic bacteria have been shown to have a number of beneficial immune and health effects. They not only enhance the bioavailability of the nutrient and moderate health, They also involve in regulating the bacterial ecosystem and modulate immune cells, particularly the Th2 response and Th1 response. These all are going to affect the lung functions. There are so many cytokines. These all are very much helpful. And beside all these mechanisms, we should understand what is the burden of the respiratory tract infection and why this and the new modalities, the natural way of treatment, the uses of probiotics to make healthier the lung tissues and the mucosal lining. What are the normal mechanisms? For that, we have to understand what is the burden of the respiratory tract infection in the children. This is a well-known fact that the respiratory tract remains one of the leading cause of the global morbidity and mortality among children at different ages, particularly below 5 years of age. Most children younger than 2 years experience several RTIs during the first year of life, as we all know that 5 to 6 ARI can happen normally to any child before 5 years of age. 1/4 suffers from recurrent or prolonged infection in developed countries. And RTIs are a major cause for parent concern and medical visit in preschool and elementary school children, leading to school absenteeism and hospitalization. They also lead to inappropriate prescription of antibiotic in pediatric practice because antibiotics are not effective against viruses, and most of these cases ARI is caused by viruses. So there are several studies regarding the utility and the efficacy of the probiotics in respiratory system disorders, particularly the infective causes. Probiotics for prevention and treatment of respiratory tract infection in children. A systematic review and meta-analysis of a randomized controlled trial was done, in which the 23 trials involving more than 6,000 children were included. And in that, the effect of the probiotic on the number of the subject having at least one RTI episode, 17 trials including more than 4,500 children reported that the number of subjects had at least one respiratory symptom episode during the study period. Probiotic supplementation had a significant effect on reduction of the number of the subject having at least one respiratory symptom episode. Relative risk was clinically significant. In another study, where the probiotic for prevention and treatment of respiratory tract infection was assessed in the children, a systemic review, again a meta-analysis, effect of probiotic was done, and the 6 trials included more than 2,000 children reported on the number of the days the children were ill. The meta-analysis revealed a significant difference in favor of probiotic prevention group. Children's supplementation supplemented with the probiotics and fewer number of the days of RTIs per person compared with the children who had taken placebo. So that was clear message. And in another study which was done, in which the 1,499 children reported on the number of the days absent from the day's care school, the meta-analysis revealed that children supplemented with probiotic had fewer number of days absent from daycare school compared with children who had taken a placebo. In which, so altogether, that makes that when these were taken together, the present systemic review and meta-analysis suggest that probiotic consumption may decrease the incidence and illness during the RTI episodes. So one of the important probiotic is Lactobacillus. And Lactobacillus is considered to be the oldest documented probiotic. It is a genus with gram-positive bacteria, and these rod-shaped bacteria comprise about 183 known species, among which the Lactobacillus plantarum and ramonosus has been studied extensively in respect to the respiratory system. And there are several others Bifidobacterium and other bacteria are also being studied, but these two has got significant number of study, and the responses. The Plantarum DR7 alleviate URTI via decreasing plasma pro-inflammatory cytokines, tissue necrotic factor alpha, interferon gamma, and increasing anti-inflammatory cytokines like interleukin 10 and interleukin 4, reducing plasma peroxidase, TBA level, and antioxidative like FRAP level, enhance mucosal epithelial integrity leading to reduced infiltration of the antigen. And this is how this particular the organism, this L-Plantarum DR7 is going to be helpful, producing some benefits, significant benefit rather. Lactobacillus plantarum capable of metabolic process, probably including synthesis of the active antimicrobial substances. The another one, Rhamnosus, Lactobacillus rhamnosus, the species GG Lactobacillus rhamnosus GG has got very encouraging research results, and there are several recommendations now to use this. The mechanical properties of this rhamnosus are among the most extensively studied among the probiotics. Different strain of this probiotic have mechanical effect on respiratory tract, intestinal, urogenital, and oral cavity pathogens. Lactobacillus rhamnosus strain shows the different mechanism or the properties: autoaggregation, co-aggregation, adherence, competitive exclusion, competitive by steric hindrance, by adhesion, and competition by binding sites. So there are several mechanisms. Lactobacillus GG may influence the incidence of infection by stimulating non-specific immunity and enhancing humoral and cellular immunity. This immunostimulatory effect of the bacteria have previously been shown to prevent recurrent infection in children attending daycare centers. So in one of the study, a total of 131 children were recruited into the study during one common cold season and randomized to consume once daily probiotic product or placebo. Daily consumption of the probiotic product for a period of 3 months significantly reduces the severity of symptom, nasal congestion, running nose. These all predominant symptoms of ARI was reduced. Moreover, the significantly less concomitant medication was used in probiotic group, and they concluded that probiotic containing Lactobacillus plantarum reduces the severity of common cold in children, as reflected in symptom relief, reduce need for medication during the study, and reduce absence from the daycare due to sickness. In Lactobacillus GG, prevention of the gastrointestinal and respiratory tract infection in children who attended daycare center, a randomized double-blinded placebo-controlled trial suggested that the significant reduced risk of upper respiratory tract infections, a reduced risk of respiratory tract infection lasting longer than 3 days, and significantly lower number of days with respiratory symptom, and it was significant statistically. They concluded finally that considering the significant decrease in the number of upper respiratory tract infection children treated with Lactobacillus rhamnosus GG. So, in another one, where the randomized controlled double-blinded placebo-controlled trial of 742 hospitalized children were done. They were randomized allocated to receive for their hospitalization in rhamnosus a dose of 109 CFU or placebo. In regard to respiratory tract infection, all patients had upper respiratory tract infection. In the LGG group compared with the placebo group, it was found that the significantly a reduced number of respiratory tract infections, an episode of respiratory tract infection that lasted 3 days. Patient in the LGG group had greater survival probability without respiratory infection during hospitalization than in the placebo group. So they concluded that the LGG administration can be recommended as a valid measure for decreasing our risk for nosocomial respiratory tract infection in pediatric facility. In another study, the double-blinded randomized trial, 571 children started this study receiving either milk-containing Lactobacillus GG and control milk. The time without respiratory symptom was significantly longer in the Lactobacillus group compared with the control group, and it was also statistically significant. In another study, the number of the children with respiratory infection, otitis media, sinusitis, bronchitis, pneumonia was significantly lower. In the Lactobacillus group, relatively reduction was 17%. There were also fewer children in the Lactobacillus group who were prescribed antibiotic for respiratory infections with a relative reduction of 19%. So they concluded that Lactobacillus GG may reduce respiratory infections and their severity among children in daycare. Prophylactic Lactobacillus GG reduces antibiotic-associated diarrhea in children with respiratory infection. Again, a randomized study was done, and different probiotic preparation, including lactobacilli, are recommended frequently to prevent antibiotic-associated diarrhea. The incidence of diarrhea was 5% in Lactobacillus GG group and 16% in placebo within 2 weeks of antimicrobial therapy. So it was concluded that the probiotic strain Lactobacillus GG is effective in the prevention of diarrhea in children receiving antimicrobial treatment to respiratory infections. So to conclude this, respiratory tract infection remain one of the leading cause of global morbidity and mortality among children at different ages. In a time when drawbacks and the risk of unjustified antibiotic treatment have been understood, patients and doctors may be turning to probiotic as a safer means to prevent and treatment of disease. Probiotics may exert a wide range of beneficial effects, such as balancing the host gut microbiota and interacting with the innate and adaptive immune system, which may promote resistance against pathogens. Probiotic contains Lactobacillus plantarum, reduces the severity of common cold in children. GG-DR7 probiotic generally, plantarum DR7 probiotic generally exert protective role against URTI, primarily via enhancing immunomodulatory and anti-inflammatory function. Lactobacillus GG administration can be recommended as a valid measure for decreasing the risk for respiratory tract infection. Furthermore, the GG is effective in decreasing the duration of RTI. Thus, probiotics have a role to play in prevention and treatment as adjunctive therapy of respiratory tract infection. Thank you very much.
So thank you, Dr. Gaji, for this excellent presentation, and that was quite thoughtful. Now we are as the result of two excellent presentations, we have been bombarded with questions through the viewers link as well as through Facebook Live. So there are so many questions that has been posted by the viewers. I'll just try to take one by one each of these questions. So there are one subset of questions where they want to ask you about the role of specific micronutrients as a supplement for a prolonged period of time in pediatric population of those who are having frequent RTI. So one question is, do they need a supplement? The other question is, if they do need a supplement, what is the ideal molecule or what is the ideal combination molecule and for how long? And do asthmatics require specific supplementation? So I would like Dr. Vora to take up this question. So do pediatric patients with frequent RTI need to be supplemented with any form of micronutrients, and for how long? And do the asthmatics have need a special supplementation? I think you are
Thank you
new.
very much. Thank you very much for the question. The role of micronutrients and how long to take it, and how is it really going to bring down the incidence of respiratory tract infection in children. Of course, we have evidence which has shown that this micronutrients like vitamin D, zinc, C, and all the vitamins, they do have a role. Because see, we are born with an immune system of our own. We have both the innate and the adaptive immunity. These nutrients are not going to increase change these adaptive or the innate immunity in any sense, but it's going to prevent us from the infections through its whatever antimicrobial activity that, or the immunomodulatory activity that it has. So there is no role of, I think, the normal supplementations to diet is what is actually the most important thing. A good balanced diet, and in terms of fruits, vegetables, fresh vegetables, what we need to encourage in our children, so that they get a proper supply of these recommended vitamins, which are readily available in our foods. Active sports, going out in the sunlight. Of course, the recent the 2022 guideline that has come out for the vitamin D supplement in children in the Indian pediatrics, it has recommended that it has got some role, and especially in children who are immunodeficient, or children who are asthmatic, or has got a chronic lung disease, or children with nephrotic syndromes or something, we need to keep the vitamin D level more than 20 nanogram. So that is one thing where we can prevent the infections in these children with immune deficiencies, basically, but as well as in children with asthmatics. But are we going to prevent attacks of asthma? Are we going to overcome these asthma attacks? Of course, it has got no role as such. Of course, the immune system, immune modulatory system can only the effect of vitamin D is only the immunomodulatory activities. Thank you.
I absolutely agree with you. So at the beginning of pandemic, basically we have been bombarded with so many advertisements suggesting that haldi lelo, nimbu lelo, this lelo, that lelo, it will boost up your immunity. But parents need to understand that it's the immune makeup of each and every individual that are different. And therefore, just giving certain food or certain medications cannot overnight improve the immune status. For vitamin D, yes, because there is a endemicity of deficiency or insufficiency in our population, and yes, it is not possible for kids to actually go out in the sunlight regularly between 11 a.m. to 2 p.m. with the time where actually vitamin D synthesis occurs. So definitely vitamin D supplementation holds some role, but as of now, evidence does not suggest a long-term supplementation of other micronutrients. It is better to fall upon on a healthy diet and a healthy lifestyle, a diet that is full of different vegetables, fruits, and animal products or milk products with requisite amount of carbohydrates, but not for prolonged period of time. But yes, during episodes of upper respiratory tract infections, or in between two episodes of a frequently relapsing respiratory tract illness kid, or one who is immunodeficient, there could be some role. So thank you on that, Dr. Ghazi. The next question is directed towards you, and it asks you that whether there is any role for preschool and school-going children in supplementation of a specific probiotic or a probiotic combination, and if yes, for how long and what combination? So this is what the question asks you. So over to you, sir.
It's a very good question, pertaining question, but it is not recommended for everybody, but those who are having, or those who are prone to get infection more than the normal, and the school absenteeism is more, or they are asthmatic, or having some allergies, or allergic rhinitis, or having some particular close contacts during that period, then it is recommended. And if it is being given for that particular reason, that the child is having recurrent infections several times, more than 6-7 times in a year, or every 15 days or every month, then the Rhamnosus GG can be given up to 3 months on daily basis. And if it is just a case and you want to get shorten the period, it can be used on daily basis for 5 to 7 days only to reduce the durations. And the combinations has not been recommended by any particular authorities, or then there are several researches available that they are more beneficial, but that is not at that level to recommend that combination. So we can go for either of these two, the Rhamnosus GG or Plantarum DR7, but the duration is variable according to the desire or the indications. Thank you.
Thank you for your excellent reply. So to continue on this, there are more questions regarding probiotics, and someone wants to ask that in your clinical practice, how often do you prescribe probiotics? I will just modify the questions in indications outside the gastrointestinal tract. Yes, we all do prescribe probiotics for acute diarrheal episodes or recurrent diarrheal episodes. Today's discussion is more on respiratory tract. So my question to you would be, how often do you prescribe probiotics outside GIT indications? And if you are using a probiotic, which particular probiotic that you are using, you are already have answered for respiratory tract. It could be either Rhamnosus or it could be Plantarum DR7. But how often in the real world, how often would you like to prescribe in respiratory cases, or maybe outside, in any cases outside diarrhea?
Yes, this is a very good question. Once again, we all are using the different kind of probiotics in GI infections, GI disorders, but in case of respiratory cases, we are not using like as we are using in GI tract infection, but definitely, particularly in case of asthmatics, in case of prolonged cases of bronchiolitis, particularly when the episodes comes last 2 months back in September, we had so many bronchiolitis and everybody requires oxygen and everything. Almost all the ward were full and we were using oxygen. They were in the distress, almost all the beds, and distress was continued for 7, 8, 9, 10 days. So we started using this, and definitely we are not giving these drugs in or the probiotics in all the cases of respiratory tract infections. But whenever it becomes difficult, not only for the parents, but also for the doctors, then we are using this. And in chronic cases like asthma and some other chronic infections or the allergic problems, we are using this, but not as frequent as the GI. Thank you.
Yes, thank you. So next question, I will ask a question to both the panelists. Now, there is an entity called persistent bacterial tracheitis and persistent bacterial bronchitis, which often require 2 weeks of antibiotic as the recommended treatment. At times it may require 4 weeks of antibiotic therapy for persistent bacterial tracheitis. Now, the commonly prescribed and the recommended antibiotic is coamoxiclav over here, amoxicillin and clavulanic acid. My question is, yes, we do prescribe a probiotic along with amoxicillin preparations for most of the times, or at least some of us do. My question is that, do you think that combining a probiotic with coamoxiclav for treatment of persistent bacterial tracheitis or persistent bacterial bronchitis can actually hasten up recovery or treating the infection? And if so, whether it should be a probiotic that is more gut specific like Saccharomyces boulardii or Rhamnosus GG or Bacillus clausii, or it should be a respiratory microbiome specific like Plantarum DR7 or a Rhamnosus again, or it should be Rhamnosus GG unequivocally, because it has got proven role both in respiratory microbiome or gut microbiome. So your insights, please. I would like both my panelists to.
Yeah, this is again a very good question, a very pertaining question, and full marks goes to the person who has asked this question. Whenever
I take the credit because I have asked the question.
then we must clap for you. Okay, whenever we are going to use the antibiotic, particularly the amoxicillin, which is known to produce GI disturbances for a so long period, particularly more than 10 days, more than 14 days, sometimes months, and sometimes 3 months even. There are certain conditions, and particularly if it is associated with respiratory disorders in which we are using this, and most of the disorders are related to this when we are using this for that prolonged period. We are more concerned practically about the GI disturbances rather than improving this condition so far the use of amoxicillin is concerned in using the probiotics. So we have used in many cases the Lactobacillus clausi or this Saccharomyces boulardii, but in the recent times, in my practice clinically and clinical practice, we have changed these things in Rhamnosus GG, and we are observing that still data is not available. It is, but we are feeling that there is some improvement in respiratory tract is some at early ages, means which requires the symptom relief gets in 7 days, 8 days, sometimes 14 days. Previously, it was used to get relief, particularly the chronic tracheitis and the chronic, even the ear infection. When we are using the CSOM, in CSOM, we have to give the amoxicillin safe type. We have to give for a very long period. So we are using this. And in many cases, we are seeing that the response to the symptom has come much earlier. So now it has to be documented, and a good study is required to be done, and hope that it will be much beneficial. So personally, I will go for, when we have to look both the things, GI tract and the respiratory tract simultaneously, along with the amoxicillin, then I will prefer personally Lactobacillus rhamnosus GG rather than this other one. There's the DR7 or some other Saccharomyces boulardii or something else. What is the take of Dr. Vora? Dr. Vora will tell.
Yeah, sir, the question pertaining to basically to PBB, protected bacterial bronchitis. If you look at the basically pathogenesis of the disease, where the basic it's basically a microbiological condition where there is a biofilm formation in the respiratory tract, resulting in a prolonged infection, and the children which will present with us with prolonged wet cough, basically of more than 2 weeks duration, and there should be some microbiological evidence to suggest that there is an underlying infection. And the best diagnosis is always a retrospective diagnosis, where the cough will recover with the use of amoxicillin for at least 2 weeks of duration. And it is always a bacterial condition, basically. And there is the most common is, I think, the Monoxella catarrhalis, which has been widely studied, and then followed by Streptococcus and Staphylococcus infections in children. Most of the time, in children who are less than 2 years of age, there could be associated airway anomalies also, where there could be a prolonged infection resulting in PBB. See, what we are discussing about is the role of antibiotics in PBB is, of course, is well documented, and that we have to go for a course of 2 weeks to 4 weeks of antibiotics. And the most accepted antibiotic is the amoxicillin, which is to be used. Now, why we are using the probiotic for? If you are using the probiotic for the dysbiosis, which will be caused by the amoxicillin in the gut microbiota, then of course, as you have said, this our choices will be either Lactobacillus GG or Saccharomyces boulardii. And if we look at the probiotics used in GI tract, the most widely accepted and the most well researched is the Saccharomyces boulardii, of course. and Bolardi has the best evidence in gastrointestinal tract infection, followed by Lactobacillus rhamnosus disease. I think if you want to start an antibiotic with a probiotic in a childhood respiratory tract infection, we should always, first of all, look at the etiology of the condition and try to. The probiotics will always act as an adjunct to the treatment. It cannot be the mainstay of treatment. So, if you have a child who has a prolonged respiratory tract infections, prolonged respiratory signs and symptoms, there has to be some etiology, which even in the case of allergic rhinitis, asthma, the mainstay of treatment will always remain the same, and all these probiotics will always act as an adjunct. The new probiotics are coming up every day. We are finding a new probiotic. Of course, over the years, we'll have more robust evidence for this probiotics maybe, and where we can firmly say that they have got some actions. But till then, I think we'll stick to our the mainstay of treatment should be the main drugs, and these probiotics should be used in adjunct only. Thank you.
Yes, thank you for both the insightful explanations. So what I gather from these two deliberations is that either persistent bacterial or the protracted bacterial bronchitis or protracted bacterial tracheitis, primarily it's a bacterial condition, primarily it's a microbiological condition. So the mainstay is antibiotics, obviously. What I was trying to ask you is that a choice of probiotics when we are giving amoxicillin for 2 weeks, and we kind of get into this that yes, there are probiotics that have been recommended with antibiotic associated diarrhea. There are probiotics that are gaining their or antibiotic associated dysbiosis, and there are probiotics that are gaining importance in respiratory microbiome. What I believe that Rhamnosus GG is one such probiotic strain which has got its usage in respiratory microbiome and which has definitely been recommended in antibiotic associated dysbiosis, even in the latest ESPAGAN guidelines. So combining goodness from two different sources, we can safely say that if we use a probiotic for a protracted bacterial tracheitis or bronchitis where 2 weeks of antibiotics needs to be given, we can use Lactobacillus rhamnosus GG because there has been effects pertaining to dysbiosis, there has been effects pertaining to remodification of the respiratory microbiome. So thank you on that. There is one more question, and now it talks about allergies. Somebody has asked you, both our esteemed panelists, about the role of micronutrient supplementation, role of probiotics, and the duration of these supplementations in preventing allergic conditions or in treatment of allergic diseases in children. So, Dr. Vora, would you like to respond first? Then I'll.
See, again, as we have already discussed, especially there's been a lot of studies on atopic dermatitis, recent studies on probiotics on atopic dermatitis, and there are, of course, clinical evidence where it has shown the immunomodulatory functions as well as the skin remodeling also, and the basically the ectopic MRSA, which can be prevented by using this probiotics. There are studies and there are evidences also, and of course there are studies that show that prolonged use of this probiotics up to 3 months of period of 3 months can effectively bring down the modulatory changes that occurs in these allergic diseases. Again, as I have said, the mainstay of treatment always remains the same. Of course, they can be of course used, and for a period of around 3 months is what usually is recommended.
Thank you. And your take on this, Dr. Ghazi?
Yeah, it is very important to use this probiotics, particularly in the allergies and asthma, the skin allergies, the atopic dermatitis, and these things. And for that, it requires for prolonged period. And the drugs, the probiotics which should be used, that should be selected on the basis of the mechanism of actions and the effectiveness. So the mechanism of action which acts through the cytokines and through the T cell mediated activities, that hypothetically that is going to be more effective. But there are so many recommendations but still more studies are required to select the best one. But still we can go for the Rhamnosus GG as well as the DR7, but that has to be given for at least 3 months. Thank you.
Thank you. Yes. Again, the consensus statement is that yes, it has got role in preventing allergic conditions, especially the skin predominant, that is the atopic dermatitis, has been widely studied, and we can jolly well extrapolate the data to understand that yes, the atopic march is always there, and therefore the respiratory allergic manifestations can also be prevented to a certain extent through nutritious diet, through adequate and justifiable supplementation whenever needed of micronutrients and probiotics. In fact, we have by now, I hope we have covered all the questions, and this has been an excellent 1 hour 15 minutes of intense discussion. Let us now come back to the very basic, and let us just allow me 30 seconds to share my take on micronutrients and probiotics in pediatric practice in a very lighter note. You see, we as pediatricians or doctors at large, we can only work 24 hours a day, and that too for a short period of time. After that, as we grow old, our ability to work diminishes, so our ability to earn also diminishes. But if we can find nice ways of and right ways of investment, then whatever we have earned, we can actually magnify that to a very significant level. So there are different avenues of investment that nowadays all the major part of the educated world are looking up to. So at 21st century or in 2022, we have almost limited our resources in terms of antibiotics or definitive treatments. We are now trying to also search for avenues to multiply the effects of an antibiotic, multiply the effects of a definitive drug, and probiotics, micronutrients, all these things, maybe omega-3 fatty acids in certain situations, these kind of acts as those smart investment plans. If chosen judiciously, they can boost up our earning, or they can boost up the eventual effect of the definitive drug. They are not the primary source of income. They can always be adjunct to the primary modes of therapy or the primary source of income, if you want to draw the corollary. And these are kind of investments which would reap benefits in future. So a sound body, a proper dose of probiotics, micronutrients, and all other essential micro things can eventually lead to a healthier tomorrow. So this is my take on usage of these dietary supplements and probiotics and how they are gaining importance. So I think on that note, we can call it a day. Team Lupin, what do you say?
Yes, sir. I think it was. I first take the opportunity of congratulating both the speakers of the panel, Dr. Partho and Dr. Ghazi Ahmed. I believe it was wonderful deliberations. Very, very pertinent questions came up, and I'm sure the HCPs who have connected us on this program will have a lot of clarity as to how to use and when to use the micronutrients as well as the probiotics. I was so glued to the monitor, I could not answer the nature call. So I will definitely do it once I close the session. But excellently done. It was so wonderful. It was definitely a goosebump raising experience, and excellently moderated by Dr. Shomik once again. And the best part, he saved it for the last. He has actually summarized the entire thing into the 30 seconds. So congratulations to all three of you. And I take this opportunity of thanking my colleagues from Patna, Mr. Pankaj, Mr. Arup from Bardhaman, Mr. Shomok from Kolkata. I also would like to thank Jinsi from our PMT and Arvind from technical team who has made this event possible. We look forward to such wonderful rendezvous in future as well, which will be informative and quite engaging in future as well. So we wish all of you have a safe, happy, and prosperous New Year 2022. With that note, I would like to conclude this today's discussion. Thank you very much. Thank you very much for giving us this opportunity.
Thank
Thank
you.
you very
Thank you,
much.
sir.
Happy
Thank
New
you so
Year
much.
to all.
Thank you, sir.
Yes, thank you. Happy New Year, and more importantly, a safe New Year. The next
Yeah,
1 month will be
in
very
fact.
crucial. So please be safe. Good
Yes,
night.
sir.
Thank you. It was
Good
wonderful.
night.
Thank you.
Good night. Good night.
Good night, sir. Good night.
Yes, sir. Recording stop here. Yes, yes.